The two biggest things that I've seen certainly in our program and in talking with others is, do you have a champion and are you committed? When you start an integrated care team, and I'll just use a tumor site, say you want to start an integrated care team for lung cancer patients. And if you have a physician champion, and really need to have a physician champion for an integrated care team, if you have that champion, it doesn't have to be the person who's been there the longest or that has the longest CV, but it's a person that really has the passion for that integrated care team. That's the number one thing I think you have to have. That's a best practice. And that might be someone who has come forward and say, I want to build this, or I want to be part of building this. How can we do that? Or it might be someone that you see has the personality or the right panache, I guess I should say, to do that, and you're showing them the benefits of that for your program. And so you work together to identify that person as a champion. And then it's the commitment. It's the commitment of your entire healthcare team. It's the commitment of your administration to say, yes, this is what we want to be as an integrated healthcare system and delivering care to our patients. So it's having that champion on board and having the commitment of your team, I think, are the two most important best practices in building it. And then it's jumping in and getting it done, because it does take some time. Communicate, document. And whatever the communication looks like, that might mean that you get together and have a morning huddle if that's what works best for your system. It might mean that you are providing lunch every day, so everyone gathers together informally and talks about what's going together with your system. The scale of your organization is going to impact, how you do that, right? If you're one or two physicians with 4 or 5 supporting personnel, you can do that differently than if you're an astronomical organization with 10 new cancer cases every year. The other thing that's going to be really important for communication is making sure that you're documenting the recommendations that the integrated team puts together in the EMR, so that whether you're the provider that's taking care of the patient specifically, or if the primary care provider who is seeing them on an outpatient basis for their runny nose or their sore back or what have you, that you also know what the plan of care is for the patient, what was discussed by the care team that's taking care of their cancer. So document, communicate, and make sure you put it in the record so everyone knows what the plan of care is for the integrated cancer care team.